When we think about chronic pain, pain is either chronic or acute. And acute pain is recent pain. It usually has inflammation in it. Whereas chronic pain is pain that goes on for a long time. It's been happening for a long time. And chronic pain can also become a little bit acute. The most important thing to realize with chronic pain is you must get out of that place of stress, which we call also the place of flight or fight. And one of the ways of doing that is by accessing your unconscious mind, your autonomic nervous system, the automatic nervous system, that part of your nervous system which generally cannot be controlled by the conscious mind. And we can do this in four main ways. One is to access our blood flowing system so that you improve circulation but without making your heart race. So inside the blood, there are molecules which carry energy and molecules which transmit information. And so when you get blood flowing through the body, energy is shared through the body, and provided your heart rate stays low, the information that passes through your body is that of love and peace and trust, a state where your body will be comfortable to turn on the immune system, your digestive system, and your reproductive system to help you heal from whatever is causing the chronic pain. So in getting enhanced blood flow while feeling relaxed is paramount. The next thing is using spinal reflexes. And the most important spinal reflex to get rid of is the stretch reflex. So the stretch reflex is the reflex that normally if you hit your knee with a hammer, the knee will jerk up. And so to get rid of that reflex, four important things will be available for you. One is when you're making a movement, it's more likely to provoke pain if you move quickly. If you move slowly, you inhibit the stretch reflex. So if you know that when you move it's going to hurt you, move slower, not faster. That inhibits the stretch reflex. It also helps a little bit that if you're moving into a position and you know it's going to hurt, stay conscious of that position. Put your mind into it. And what you want to put into it is a sense of relaxation. So it helps if you focus on the part that you're, likely to cause problems with, and focus on it, not in a negative way, just be aware of it. And you're less likely to tense that part up, less likely to overstretch it when you move. It also helps to breathe in a relaxed way. When you breathe in low and you exhale passively, you generally don't overstress or overstimulate the place that becomes a problem when it becomes tense or painful. The other thing to do is we need to access the unconscious mind using what I'll call the 12 bridges between the conscious and the unconscious. So the 12 bridges between the conscious and the unconscious are the places which have dual control. They can be accessed both consciously and unconsciously. These places include your diaphragm, which is the main muscle of breathing, which sits just below the rib cage. And when you inhale diaphragmatically, this will feel like you're breathing into your abdomen. So as if I put my fingers in my lower abdomen and inhale, I can feel my lower abdomen expand like a balloon is underneath my fingers. And that's how the inhalation should feel. It doesn't have to be big, but you just want to feel it comes there, less into the chest, more into the abdomen. You want to feel that your exhalation is passive or soft. When you exhale when you're asleep, and I'll just demonstrate this for a second. If I'm lying in bed and I'm exhaling while I'm asleep, my inhalation will tend to expand the abdomen, less of the chest and more of the abdomen. And when I exhale, the air goes out pretty much by itself, no muscles tense. And in this situation, when I'm lying on my back, the abdomen will go down toward the spine. Now, that doesn't happen if I'm standing up. So if I'm standing up, then if I breathe in and expand my abdomen, if I exhale relaxed, gravity acts downwards, so it's less likely to bring my abdomen in, and the abdomen will hang out if you're standing and you relax. So another way of exhaling completely without causing tension is to use the transverse abdominis muscle. That's this belt-like muscle that goes along the lower trunk. And when you contract the lower abdomen, you can roll the abdomen like this. So you often here engage the lower abdomen. I'm bringing in the lower abdomen without even changing the upper abdomen. And if you can eventually learn that, that can be a big thing to help you access the ability to relax and breathe naturally, massage the internal organs. How do you do that? Well, that you need to learn in my courses, especially in 5-dimensional flow. I've explained that in detail. And it takes some practice also. There's simple exercises you can do that will get you to it. And we'll come to them a little bit as well. The next thing you can do is to recognize that the diaphragm is not the only place that you can access the unconscious from. The diaphragm is special because you can breathe in consciously to your abdomen, but also when you're not thinking about it, it happens by itself. So other places which have dual control, both conscious control and unconscious control, so they happen sometimes without you thinking about them, include your face, your arms, your legs, your neck, and your pelvic floor. The pelvic floor has 3 places: urethra, anus, and the genitals between them. Learn basically how to relax these parts. And when you relax them, also move the pubis. So you roll your pubis in a circle like I'm doing, either a backward rolling circle or a forward rolling circle. So this is forward rolling and this is backward rolling. You can also move your hips in a circle or in a figure 8. But you don't want to stress this out. Don't do it so it causes pain. You're just trying to establish freedom. The connection between your shoulder blades and your fingers is also good to free up. So the trick is to lengthen your fingers and check they can move, to move your shoulders as far away from the base of the neck as possible and check the shoulders can roll. You also want to feel a connection from your hips to your toes. So if your toes are in the air, you can move your toes. And with the pelvis, gently moving the pelvis while relaxing the pelvic floor can help reset your nervous system as well. Then the neck is also important to move. So you lengthen the neck and gently move the neck. Then the face has got 5 sections you can control. One is to make saliva. So you salivate and maybe swallow. Another is the jaw, so you move the jaw gently. A third is the lips, so you move the lips gently. Smiling is very good. Then the other place is the outer eyes. So we know that when we blink, it often is as a reflex. Something comes in front of your face and you blink. But if you mimic blinking slowly, you get a good relaxation result. So rather than practicing blinking yourself, which you could do, and it is helpful, better do a slow blink. So for example, when you fall asleep, the eyes don't rapidly shut, they shut slow. And when you wake up in a restful way, you don't open the eyes quickly, they open slow. So one of the exercises you can do to calm you down, to reset your nervous system to that calm, parasympathetic dominant state, where healing takes place better and less pain arises, is you open the eyes, close the eyes. But not open fully necessarily, not close fully, just half open, half close. Or if you wish, you keep the eyes fully closed and pretend to almost open, pretend to almost close. The other place is the inner eyes themselves. So when we're asleep, the inner eyes tend to roll up. So if you practice going up with your eyes, down towards your nose, up towards your third eye center, down toward your nose. And you can do this in many ways. One is going up, forward, down, in, up, forward, down, in. Another is to come up, in, close, then out, far away, up, in, close, then down, far away. And you can also make the eyes go in circles. All of these are useful, but you don't want to make it stressed. So if you know your eyes might look up this high and this low, maybe only move half the distance up a little bit, down a bit, and you can practice with your finger. If you do all of these things, you'll find the nervous system says more accurately than your rational brain, are you in threat? Are you needing to be in flight or fight? And if the answer is no, and usually it's going to be no, your body resets to parasympathetic dominance. And you come out of that panic state, pain reduces, and generally you'll be starting to feel a lot more comfortable. So the simple exercises we can use to do this are, number one, well, I've got a microphone in my left hand, so I'm not going to use my left hand. Number one is lengthen your fingers, but check the fingers can move. And not hard hand, not relaxed hand to wiggle, but lengthened hand. This is lengthened and hard. This is lengthened and soft. But this is relaxed. So lengthened, but not tense. Relaxed, but not flaccid. And then with the fingertips lengthened, move the fingertips. Like the fronds of a sea anemone. Then you can either stop the fingers, but keep them lengthened, and move the shoulders apart and roll the shoulders. Then you can stop the shoulders, lengthen the neck, and gently move the neck. You can be moving in a little figure 8 or infinity sign like I'm doing now, or you can move the chin in, up, forward, down, but again without stretching. So my infinity sign could be very big, but I'm going to choose to make it very small. And then from there, I can bring the chin in, up, forward, down. Could be big, but I prefer to make it small. Then again, the pelvic floor. So you relax the pelvic floor and roll your pelvis. And this helps free up your internal organs. And then the lower back. So lengthen your lower back. If you're standing, bend the knees a bit, drop your sitting bones, lengthen the lower back, and then breathe into the abdomen like you do in your deepest, most regenerative cycle, sleep, and then either let the air out softly or roll the air out like I'm doing here. Then the face. So with the face, the trick is to be completely relaxed and practice the things that help you relax. So make saliva, swallow it, move your jaw a little bit, move your lips a little bit, like smile helps. And then gently open, close the eyes. And maybe at the same time you could lift eyes up, bring eyes down. Eyes open, eyes up, eyes closed, eyes down. This sort of thing. If you practice this individually, you can get out of pain, you can get out of trauma. If you practice them all together, you get a very, very good result. So here's me practicing them all together. I make a click between each one, and then I practice one at a time first, then all together. This is such a lovely thing to do. When you do this, you start to relieve pain. Here's another tip for relieving pain, and this one is to do with releasing muscles around the painful region by activating the opposite muscle. So the trick is, if you've got pain on the inner knee, tighten the outer knee. If you've got pain on the inner hip, tighten the outer hip. One of the ways of doing that is to shift the weight to one side, lean on one leg, and you can hold a wall if you wish, and lift up thigh off the floor. And then you'll feel how the outside thigh becomes more active, the inner thigh relaxes. And if you hold this posture, maybe holding a wall, for about 30 seconds, the release of the deep sensations such as pain on the inner thigh, inner knee will go away. But while doing it, think again, fingers can move, shoulders can roll, neck is free, pelvic floor relaxed, abdomen can breathe, face relaxed. This is important. Then if you have pain sometimes on the front of the knee, what you can do is tighten the back of the knee. And an easy way of doing that is to turn your thigh inwards, lift up the leg, and you'll feel the hamstring is firm. Your job is just to relax the muscles you don't need, relax the abdomen. And whenever you're using this type of reciprocal relaxation, which is a type of reflex reaction, you must make sure that everything else is relaxed. So again, move the fingers, roll the shoulders, move the neck, relax the pelvic floor, lengthen your lower back, and breathe into the abdomen while you gently rock. Then relax the face. And generally that can get rid of knee pain at the front because you've tightened the back. And this principle you can use all the way through the body. Just always make sure when you're doing it, you take a few moments to relax. And part of that relaxation is you check you can breathe into the abdomen. You have to work out what activity could you do which switches on the muscle opposite to the one that's tense in you. Another way to get a sense of reduction of chronic pain is to use a breath technique where you connect from your thinking brain in your head to the action brain or gut brain, also called the enteric nervous system, which is a big part of your autonomic or automatic nervous system. And it basically wraps around your intestines and controls all movement. So what you want is to feel like the breath starts in that region in your enteric nervous system, because what happens is your diaphragm's going to move downwards, and as it moves downwards on an inhale, it compresses that region. And that compression can massage the internal organs, release the lower back. So the trick is to inhale diaphragmatically, but then where do you inhale to? Inhale directly toward the place where you've got the most tension. It's very difficult to think of inhaling into anything other than your chest or the abdomen. Most people's conscious inhale is limited to their chest. So you need to practice relaxing and lengthening the part you want to breathe into, and we can do a couple of exercises. If I want to breathe into the abdomen, it's fairly simple. I just relax my belly, put my fingers in the lower abdomen, and then I inhale. And certainly as I inhale, with the fingers just above the pubic bone, I can feel expansion there as I pull down the abdomen, pull down the diaphragm. But if I ask you to breathe into your lower back, you can try it. So stand up straight, breathe into your lower back. It doesn't really go to the lower back. You have to do three things to breathe into the lower back. One is bend the knees slightly and lengthen the lower back by dropping the sitting bones down and forward, top of the hips backward and up. So now I've lengthened the lower back. Now I have to relax that whole region. So to relax the lower back, you need to relax your pelvic floor, your abdomen, your face, even the armpits have to be a bit soft. And then having lengthened the lower back, relax the lower back, think of the lower back, and breathe into the lower back. And often that will relieve pain if you do that. You can do that to any part of the body. So I can breathe in the back of my neck to reduce neck pain by bringing the head down and the neck back with the jaw relaxed. So now I've tensioned or lengthened the back of the neck. Then from there, I direct my consciousness in my thinking brain to my action brain at the core, and then instantaneously I get a transmission from cactus to the lower abdomen to the region which is problematic in my back. Bend the knees, round out the lower back, sense the breath beginning in your abdomen, and then direct it to the sense of where the pain is in your lower back. And that can be really helpful sometimes and can relieve a lot of pain. So what we want as a general rule then is to be connected to our unconscious. These bridges are real key. And you take the breath which is concentrated on from your mind, projected out by the core, and you take it to the place where the problem is. So if I've got pain in the back of my neck, I take my conscious thinking mind, put it into my chakra center, this kanda in Indian yoga, called Dantian in Japanese yoga, the center of the hara in Japanese yoga. Sorry, the Dantian is a Chinese term, my apologies. And then from there, lengthen the lower back, move the top of the hips back, pubic bone forward, relax the lower back, let your belly relax. Then breathe into the lower back, and you should feel a sense of stretch in the lower back. That can relieve discomfort. And you can do that with any part of the body, even the feet and hands. I've got teachers that can inhale to their arm and the arm swells up like a club, very differently to what you might see if they're flexing their muscles. Okay, so these are important principles. But the most important is to stay relaxed, not to panic. And this is something you can do all the time.